Hello everyone, thank you so much for tuning in to this Meet the Doctor session from Medics&Me. Today we have a talk by Dr Rao, who is a orthopedic surgeon with over 20 years experience, and we really hope you enjoy it. If you'd like to find more advice, please check out our Instagram at medics.me, and yeah, we hope you enjoy this.
Seeing people, so if you want to, please feel free to put your videos on. What I want to say is welcome, hello. I hope you're going to find this useful and interactive. There's lots of stuff that we're going to kind of cover. It's difficult for me to cover the whole in-depth aspects of orthopedic surgery very completely, and part of that is because really I can't teach you all of orthopedics in these next sort of few minutes, but I can cover a lot of what I do. And we can have questions at the end where we can then ask specifically about stuff that you want to know. I'm kind of going to aim it at people who know almost nothing about it, kind of talk to you through the whole global process about, you know, getting into medicine, getting into med school, how you become an orthopedic surgeon, who becomes orthopedic surgeons, you know, so on and so forth. So some of this stuff you may already know, but I'm just going to go right from the beginning in case you guys haven't covered that at all. So I've got a bit of a presentation. We'll go through the presentation and then we can do some other stuff about whatever you want. Okay, so that's the plan, and we're going to go for it. So let's start the show. Okay, let's go for here, and I'm gonna just. Okay, here we go. Okay, lovely people. I'm hoping you're going to be able to see this. It's difficult to know. I think I'm actually sharing the wrong screen.
Yeah, I think it's just in presenter mode at the moment.
Yeah, fine. So I'm going to stop that, start it again, and go there. Okay, good. And yeah, you know, I love this. I've always got a sort of split screen, and it always bugs out. I think I'm seeing the wrong screen. Am I still on presenter mode, Meg?
No, that's all good now.
You can see orthopedics at the front, can you?
Yeah, perfect.
Yeah, fantastic. Yeah, best thing about surgery is that you have stuff left over when you take your pets to work day. You know, I'm going to say there's lots of stuff which I love about orthopedic surgery, and I can talk for a long time about what's good about it and what's great. I'm going to say I'm really, truly blessed with the job that I do. Okay, one of the first things I want to do is kind of tell you who I am. So my name's Dr Rao. I'm a consultant orthopedic surgeon. I've actually been a consultant now for about 20 years at the Countess of Chester. I graduated from the University of St Andrews. So not only do I work at the Countess of Chester, I also work at the Nuffield Hospital. So I work both for the NHS and work privately. So you work for yourself. So, you know, I have an opportunity to earn the pay which I do at the Countess, but also work privately for myself. I don't do much of that stuff, but it gives you a salary extra and beyond what we do. Certain subjects in medicine doesn't allow that, but I'm going to tell you the demand for orthopedics is astronomically high, and I'm actually grateful to have that as an extra facility. So what did I do? I graduated from the University of St Andrews. I'm going to tell you right back from the beginning. I was born in India. I grew up in India. You know, I came over here with my father, who had £5 in his pocket. So, you know, we started really small. And I'm going to tell you, I've been very lucky to do the career that I have and become the person that I've become. So it's been very, very fortunate from my point of view to be able to do this. So I went on to Cambridge, did my training there, and then came to the Countess of Chester. So I've then become the clinical director of surgery. I'm now actually the chief examiner for all of the Royal Colleges and the international exams. So in other words, if you want to come out and become a consultant orthopedic surgeon, you kind of have to sit my exam. So it's a big exam. and this weekend we're going to Glasgow, where over 100 odd consultants and over 200 odd candidates who are quite senior doctors sit down, and we do a pretty tough exam to get out to become consultants, independently practicing consultants. So from pretty humble beginnings, I'm really lucky to get here and do what I can do. So I'm going to talk to you a little bit about orthopedics and about medicine. Most people who kind of tell you about medicine and orthopedics is just don't do it. Really don't do it. No, I'm not kidding you. Are you sure you want to do it? Are you sure you want to do it for the money? I'm going to tell you, the money, it's okay, but that you just get taxed on it. It's not a bed of roses. You see the junior doctors, they've been on strike. I tell you, if you do medicine, there's going to be tears. You've been warned. That's all I'm going to say. Fine. Having put my caveat out there, I'm going to say it's a great life. You kind of have to decide what you really enjoy. Do you like going out partying? Do you enjoy sports? Is family important to you? You've kind of got to work out what's important and how much of medicine is going to take up of that time for you. And actually, when you choose in which medical school you're going to go for, then you have to choose. It's like the quest for the Holy Grail. If you haven't seen this movie, great movie. Indiana Jones, love it. So, he's quest for the Grail, and he finally finds all these chalices, which is the right one to choose. Anyway, it's kind of like that. You've got to look to see what's right for you. Why do orthopedics? I'm going to tell you, it's hugely rewarding. It's an amazing thing. And I'll tell you part of the reason why it's such an amazing job, because if I were to ask you what would be, in terms of quality of life, what would improve a person's quality of life the most in terms of a medical intervention, things like, heart-lung replacement, or chemotherapy, maybe, or maybe something like if they come in and that they're having a major heart attack, you kind of stop that heart attack. Fine, surviving a heart attack, that's a pretty good improvement in life. I'm not dissuading you from that. But actually, if you look at all of the big interventions in medicine, the number one biggest improvement in terms of quality of life is actually not those, because actually over a period of time, you don't really radically improve quality of people's lives drastically, because they still have an underlying heart condition. It's really difficult to eradicate cancers in certain conditions. Number one is actually ophthalmology. Okay, it's not me, it's not what I do, but number one is ophthalmology. It's basically giving people sight. For people to have sight, to lose their ability to see, and then to be able to see is phenomenal. It's life-changing, and it's hugely number one, right up there as the most significant thing that you can do to improve someone's quality of life long term. And number two is orthopedics. It's that you're basically making someone who's lame walk, and actually it's a miracle. I'm many a times I catch myself in the middle of a complex operation and feel just hugely humbled and hugely blessed that people allow me to go into their hips, rip their old hip joint out, and put in a new hip for them. And they wake up immediately after the operation, and they go, oh, the pain is gone. And not only do you allow them to mobilize, you kind of give them a facelift, because they're excoriating pain. They've just got this deep-seated agony, and that they actually get up and walk, and they walk more or less within a few hours of the operation, and it's just transformational. And I tell you, and they come back and they cannot thank you enough. They cannot verbalize how amazing that you have transformed their life, and how that it was so limited, and how you have made them amazingly better. And it's just blessed. It's just such a blessing. Not only that, there's the other things about, knowing the anatomy, applying the anatomy. There's a wide variety of subspecialties in orthopedics to choose from. You work with some amazing people in terms of physiotherapists, in terms of orthotists who kind of help correct sort of stuff, let alone the anaesthetists and the nursing staff, and physiotherapists, and it's just an amazing radiologist. The list goes on and on and on. And so it's a really great mixed multi-disciplinary profession, which I'm going into. And into orthopedics, it's not just what I do, which is, do things like hip and knee replacements. I also do trauma. In other words, if a kid comes off a bicycle and breaks their clavicle, their collarbone, we get to look to see, does it need fixing? If it needs fixing, we kind of go ahead and fix it. Really badly mangled arms. These things we kind of put together. And so operating on hands, elbows, shoulders, knees, spines, peds, there's a whole variety of stuff, military, you can go into a whole variety of things in orthopedics. And it's an amazing specialty. So what is orthopedics? So orthopedics actually comes from the Greek word ortho, meaning straight, and pedion, which is pedis, which is child. So originally, orthopedics was straightening bent children. So that's where it came from. It was really, kids were growing up deformed, and the orthopedic surgeons in those days were correcting that skeletal malalignment. We've got much better nutrition. We don't see rickets as much. We don't see all the other conditions as much. And so there is still pediatric orthopedics, which is kind of a double meaning. In other words, it's sort of pediatric orthopedics is straightening kids in kids. But actually what then happened is that the world of trauma then came in. And in other words, we're seeing just this really epidemic of broken bones. And actually it's phenomenal as to how much is needed. And actually worldwide, the demand for correcting these broken bones is huge. And actually trauma is bigger than, and sadly it's bigger than, and sort of disability from trauma and death from trauma is bigger than malaria. It's bigger than AIDS. It's bigger than a lot of the other major conditions that you'll hear of worldwide. Trauma is just one of the largest epidemics which is there. And realistically, it's bigger than the number of people who die from heart attacks is actually people who die from trauma. So, if we can actually minimize trauma, if we can actually make people better, if we can make people survive more and actually have no deformity, it's a huge, huge blessing. So that's part of the background history of what orthopedics is. Okay, how do you become an orthopedic surgeon? Let's start right from the beginning. So from school, you basically choose which medical school you go to, and we can talk about that if you want to. Normally it's 5 years, sometimes it's sort of 6 years, depending on which medical school you go to. You end up with your qualifications, something like an MBCHB. There's other sort of like series of letters which prove that you're a doctor. You then basically do 2 years of that, which is a foundation years. You then get rubber stamped to say that you are now a fully fledged doctor. And then you basically spend the sort of like next 8 years or so becoming an expert in orthopedics. And that's kind of how it's done. You normally start with core training, which is the first 2 years in terms of what you're wanting to do. There's the MRCS exam at that stage. And once you pass that exam, you go on to the higher surgical training post. And that's a competitive application. And we can talk to a little bit about what that would involve. Once you've done that, then you sit the FRCS Ortho exam. That's an exit exam. That's what I kind of chair. That's what I kind of run, as well as having my daytime job as an orthopedic surgeon. And then from that, you go on and you subspecialize in whatever field you want to do, whether it's trauma or whether it's pediatric orthopedics or whether it's upper limb surgery or foot and ankle surgery. You've got a whole variety of subspecialty training. There is a way of assessing people as they go through, and what that is called is an OSCE, so it's an objective structured clinical examination. And so to get into the different subspecialties, you kind of do an OSCE, and then there's interview stations, and that's normally with a portfolio that it shows you who you are, how much you've worked above and beyond what you're classically paid to work. So it's how good a candidate you are. You then given something like clinical or ethical scenarios. You also get, in terms of surgical training, practical station like scrubbing up or tying knots, and they see how you do this. Don't worry, we teach you how this is done as a junior doctor, and basically it shows your commitment to doing orthopedics, to go through to get onto the higher level of training. At the interview, you'll get an interview. It talks about your portfolios. It talks about what certificates. They look at your educational supervisor reports. And then this allows you to go on to the next stage of your training for that. I'm going to tell you, you have a large knowledge base. You know, you have to learn about emergency medicine. What happens if you have to deal with cutting someone out of a car? How do you do that safely? Radiology, in other words, how to look at the x-rays, the neurology, work out how the nerves work. Care of the elderly, which is actually a really big part of my job, because the reality is that frailty or fractures in the elderly population is a big element of what we do in orthopedics, because the number of broken hips which happen is very, very high. So we at the Countess have at least 2 elderly patients who break their hips every day, which comes in. So every day of the year, one of us is there fixing these patients, because if we weren't there fixing them, then they would languish on and die. And so it's important, even though these are very frail, very elderly patients, that we actually give them really good care and get them up and working. We have to learn plastic surgery, general surgery. You know, there's a whole variety of stuff that we need to know to allow us to deliver really excellent care to the patients. And as I said, we work with amazing people, plaster technicians, and they teach us how to put plasters on. It's a two-way thing, you know. We train doctors, we train medical students, we see people like you who come through on courses. And so we have a huge variety of different people who come through, and it's great fun. It's just great fun. If you love people, it's a great specialty. So this is us showing people how to put plasters on, you know, simple, effective treatment. If you can put plasters on, you basically stop the limb from becoming deformed. If you can teach people how to do that, it's a great thing. So I told you about putting in things like dynamic hip screws. This is a sawbone workshop which we've got, which shows people how we do it, what the steps of the processes are. And so these are plastic bones, and we get to play with real drills. It's so much fun. And then also we teach suturing skills. So yeah, it's better that we suture a banana. A banana is a really great thing to practice your suturing skills on, because if you make a bad cut on a banana, then those bananas bruise. And so it really shows you that whether you're doing it carefully, whether you've got like mushed banana pulp at the end of it. And it's a really good way of practicing. And of course, we get formal lectures, and this is me kind of, you know, telling the people how orthopedic works, and, you know, how we manage people with fractures. And so it's teaching as well is part of the whole thing. Look, there's lots of useful resources about orthopedics. You know, the British Orthopaedic Association is there. There's the Trainees Association, which is BOTA. There's lots of different websites. And of course, the GMC, as well as the surgical councils, all have issued useful resources about the different trainings and what will involve for it. And so, you know, feel free to look on the internet for it if that's what you're after continuing to do. Look, my thoughts are you know, it's great for you to get involved in orthopedics. And when you do get into med school, because, you know, that's where you're going, is have a look at it. You can do specialist SAMPs, which is placements in orthopedics, is that a lot of the medical schools have slots in there. And it's for you to go, look, I'm really interested in, you know, doing a little bit more in, you know, ophthalmology, or in ear, nose and throat surgery, or orthopedics. Can I have an extra placement? And they will facilitate that for you. So as much as there's a regular course, which you have to follow, you have to cover it all, there are placements in there where you can then go and actually get a further and in-depth experience. And we'd love to have people like that, because, you know, we need the next generation. We need people who are bright and intelligent, like yourselves, to come in and learn about this stuff. So learn the bones, okay, learn the names of the bones, and just come in. It's great. Once you're in med school, you get to scrub in with the trauma operations, and it's fantastic. It's absolutely fantastic experience to do. Talk to the registrars. They're normally absolutely lovely, bright, clever people. Do an on-call with an ST1 once you're in med school, and ST2s. Kind of help them out a bit, really. And find out what their life is like for it. Do some audits, even while you're a student. It's important to do that. You can actually go and find out what the department has wanted to look at. The audits don't need to be very long. They can be completed kind of within a week, just to see what's happening in that. And then come and speak to people, speak to us consultants, and in essence, kind of don't overthink it too much. If that's what you feel you want to do, just kind of do it, and as the film says, you have to choose, but choose wisely, and I hope genuinely that it kind of has given you a degree of inspiration to come and do orthopedics. I'm happy to take questions now. I'm happy to kind of talk to you a little bit about certain parts of what I do. But if you want to open it up, then feel free to either in the chat section do that, and then we can go from there. And I'm happy to guide you through that. I'm going to stop sharing there so you can kind of see me again, and then let's go for it.
Thank you so much. That was such an interesting talk. We just have somebody in the chat who's just said, what are the struggles of working as a surgeon? So like, what's one of the challenges?
Okay, I'm going to tell you there's a variety of them, and realistically, it's interesting when you talk, when you look at the challenges associated with it, because I'm going to tell you, you can talk to anyone about any of their jobs, and and I'm talking above and beyond the breadth of medicine, and you go, what's the challenges of your job? And there will be, but I'm going to say they're always varying, they're always difficult, and a lot of it is genuinely that it is something that, for example, you'll find that management pressures as to how many you're going to have, waiting list times, there's targets to get. I can go on and on about the worst things about my job, but I'm going to tell you, but that pales into utter insignificance compared to how genuinely brilliant it is to make people well. It is hugely a privilege to be able to do that. And what often happens, and I'm going to tell you, when you get into medicine, is that patients will come to you and will look you in the eye and go, you just do not know how much of a difference you have made to me, my life, and my family. And we, as medics, go, yeah, sure, don't you worry about that. It's not part of our job. And we genuinely brush it off. We never absorb it, we never take it, and we never, ever really value it to the extent that it's given. And it's a funny thing, because a lot of people go into medicine. I'm going to be honest with you. A lot of people go into medicine because it kind of fills a hole in them. Not if you understand what I'm saying here. There is a gap within us. We are naturally caring people. To give that care fills that hole a little. But for some odd reason, we never actually take that thanks which is there and put it in to fill our hole. It often drives us, and it's a huge privilege to be able to do it. But just be warned about that, is that actually medicine is phenomenal because it does allow us to do that. It allows us to care for people, and it fills that hole. It is just immense, like nothing else on God's earth can do. It is that good. So as much as I say that there are troubles which you will have to deal with, and that they are variable, and that you will have patients who you have just genuinely sweated blood over, and the family come and peck your head off as to how come they haven't got better 3 days earlier, and why, you know, that their x-ray has been delayed, or who's lost the form for their discharge, you know, and they blame you genuinely, but nothing compares to how good it is to make them better. So if it's an odd way of answering that question. The other thing in terms of the challenges of surgery.
Mr. Rao, I'm so sorry. I'm just going to have to, we have about 11 questions in the chat.
Okay.
So
yeah.
just in the interest of time.
Yes. Yeah, we will do. The other thing in terms of surgery, which I must tell you, the difficulty about surgery is surgeons. Okay, that's the real problem, is actually surgery is very off-putting, predominantly to women, people of color, you know, people from different backgrounds, and part of that is that it's a tough career to get into. And I'm going to tell you, the only thing that I would advise people for surgery is that if you love it, just do it. You know, just put up with some of the difficulties and the obstacles placed in front of you, because surgery is worth doing. So I'm sorry, that was the other catch to it. Yes, yeah, let's go on to the next question.
So we have about 12 questions here, so we'll just sort of fire through.
We'll go.
How do you deal with complex cases that you have not faced before?
I'm going to tell you, you always default to your highest level of training. I am genuinely blessed that I actually went through, you know, one of a pretty tough training program. It was pretty brutal. A lot of people kind of drop out and go, God, this is not for me. You know, why they're pressurizing me so hard? You know, they're just being mean to me. And part of it is that actually, when you are dealing with a situation where you have just never come across it, you always default to your highest level of training. And that level of training allows you to cope with the unknown, the uncertainties. You know, the amount of teaching they will give you is phenomenal. But it's for you to soak that up. And when you are the boss, then you basically come out with the right decisions at the right time. Does that answer that one?
Yeah, perfect. So as Hannah asked, as an orthopedic surgery, what are the top 3 skills and qualities you would say are the most important?
Number 1, tenacity. Okay, it's you know, pig-headedness, stubbornness, you know, undeviatability. I don't know if those are words really, I'm kind of making them up, but tenacity. You have to be tenacious in terms of continuing with, this is what you really like, so don't let people put you off, but tenacious to learn. You know, you're after working out, you know, how this is done, why it works. So I think tenacity is a really big key feature for it. You know, and I think also you have to understand this, like the mix between getting on with people. You'll find that the real problem is that there's a lot of orthopedic surgeons who you will come across who just answer or will get to the problem quicker than you, but that's because they don't have thought process. Well, I say they don't have an internal, you know, well, is this really right? Is that really right? Am I really thinking about this properly? You know, they'll get to the answer quicker. And so if you are quite thoughtful and introspective, just make sure you have the tenacity to know that you can still do it. Yeah. So one of the things, if I can do it as a negative, people think that you have to have a good hand-eye coordination. That's training, okay? So you will be taught that, and the more you do it, the better that's going to get. And also I think, and a lot of people may disagree with me, but actually really being able to talk to the patients, because a really good human interaction is phenomenal, because that way you give them the expectations, because if you can't do that, then they will be given a false expectation as to what their outcomes are going to be, and therefore they will never be happy, even though you have done the very best surgery in the world. So if you know, so I think tenacity, hand-eye skills will come, that will be taught, but really good patient communication is fundamental.
Also, something that all of you guys can do now to develop those sorts of skills, just because you're not a surgeon now, it doesn't mean that you can't really develop those skills. And doing things like Mr. Rao, I'm sure will agree, teaching is such a big thing in medicine. So if you're struggling with volunteering, mentoring, teaching, speak to one of your teachers, see if you can tutor someone in your favorite subject. Those are all takeaways where you can say in your interview, I went to a talk by an orthopedic surgeon and I really reflected on how important teaching is. And so to develop this skill, I did this. And so taking steps like that is a really good way to do that. Next question, how do you find the work-life balance?
It's difficult because I love my job, and so it kind of consumes a lot of what I do. So in fairness, I've gone part-time because I've gone and taken over the chair of this, and I sadly expected that I'd have more time at home. I just kind of love my job, and so I kind of have taken on different roles. I do teaching, so talking about teaching, so I've just literally completed a full course of orthopedic teaching, which was free and online, and that took hours and hours of work. So you know, so that's a simple thing. But the other side of it is that actually medicine allows you to go travel to different places, even if I'm teaching in different places. I love photography, you know, so I'm never too far away from a camera, and so it allows me to go and do things like that, you know, so it does give me the choice of doing what I can. It gives me a huge privilege of choosing as to what I want to do. That's phenomenal.
Yeah. And the next question is, were you certain what area you wanted to specialize in before you applied to medical school? And I think there's another similar one about like, is there an age limit to enter surgery, which you could maybe tie into that?
Yeah, okay, that's a good question. So the simple answer is no. I actually thought I was going to go and be a GP, you know, because I like people. I like chatting to different people. I like the variety. I like the complexity. You know, I like psychiatry. You know, I like all of these sort of things. So it was difficult to know as to which of these sort of career choices I was going to have. It's just that I actually was very fortunate in going and bumping into actually a plastic surgeon who then inspired me into doing surgery. And then from there, meeting up with some orthopedic surgeon who basically showed that there's a very set, you know, if you have this fracture, you can treat it like this, you can classify it this way, these types you do this, and the world opened to me is like, it's logical, it's doable. You just need to learn what the skeleton is, and that then inspired me to doing it. And also it's very mechanical. I like doing things and building things, so that too.
Another question was, is there an age limit to go into surgery?
So in terms of age limit, I don't think so. I mean, surgery does take time to do. I'm sorry, I just need to. So surgery does take time to do, and so for that reason, I think it's difficult to.
If you want to just deal with that, I can quickly answer a question here. One of them, which is kind of related to medical school, as there are lots of surgical specialities, does any experience you get whilst at medical school have to be related to the specialty you're interested in? So I'm at medical school at the moment, and I was on HPB surgery, which is hepatic biliary surgery, which is like the liver, gallbladder, all that sort of thing. But then some of my friends were on orthopedic surgery, some of them were on vascular surgery, some of them were on gastro surgery, some of them were on urology. And the key thing is, just like Mr. Rao said, medicine, people who are doctors want to help, not just patients, but colleagues and medical students. And I went in, and I think I want to be an emergency medicine doctor, but I went in and I often work on the major trauma ward, and I was just so inspired by max fac surgery, which is kind of like face and teeth, and then also trauma and orthopedics, which is all linked to emergency medicine. So all I had to do was go in and chat to the reg and say, oh, I'm really loving this surgical placement, I'd be really interested in seeing some more emergency cases. And as a medical student, I got to help in draining an anal abscess. And I've literally been in medical school for 3 years. And that was just from finding someone, chatting to them, showing an interest. One of my friends has arranged to do an audit this summer, like Mr. Rao said. And medical school will give you very varied placements, but you can take that so much further yourself. And throughout your medical career, just like he touched on before, he does orthopedic surgery part-time, but you can fill the rest of your time with all these incredible things and opportunities and learning, teaching, leadership, development. There are so many routes to go down and different things you can do. You can do PhDs, research, academia. So sorry, that was a bit of a long-winded way of answering, but basically, in summary, medical school could never touch on every single surgery because there isn't enough time, but you will get experience in surgery. And from that, we get student selected components where you choose where you go. Every year we have a project to do and we can choose what speciality that's in. So you really get the opportunity to kind of go wherever you want to go and focus on what you want to focus on, and there is a lot of scope for that. So moving on to the next question, is it true that one has to be physically strong to be an orthopedic surgeon? Yeah.
No, I'm going to tell you, it's a complete, if people tell you that, they're lying. It's all about technique. I'm going to tell you, I'm weedy. I have got skinny wrists. I genuinely at school, I could never hand, those dinner trays. I could never carry a tray with one hand. I had to use both hands. I'm weedy. I'm not kidding you. It's all about technique. And the other thing about it is that is that fine for there's certain stuff like major joint replacements where it is, there's a lot of things like, banging and hammering. And if you enjoy that, that's great. But actually, there is a huge amount of technique to doing it. If any of you have done martial arts, you know that the smallest of girls can, throw the biggest of guys. True, you've seen it happen. That happens in real life. If you've ever been onto and it's just that. It's you once you learn the techniques of how to swing, you can actually put in nails like the best of them. And the other thing about it is that not all orthopedic surgical subspecialties require a huge amount of strength. There's certain bits of foot and ankle surgery, hand surgery, which require very, very fine motor skills. And if you suggest that you need a high amount of strength and a lump hammer, it's just going to smash it to pieces. So definitely not. I'm going to tell you, one of the best surgeons I've ever seen, and she was about 5 foot. She was a spine surgeon. She did pediatric spines and adult spines. She was technically brilliant. If I needed spine surgery, I'm going to go to someone, and she is literally half my height and is absolutely petite.
Okay, so 3 more questions here, kind of all tying into each other. What about a difficult experience, one about managing the gruesome sight of trauma cases, and another one is about managing stress. So I don't know if you could maybe tie all that in together. Maybe also, this is a question that we get quite commonly about gruesome things. Maybe if you touch on that first and then talk about dealing with stress and difficult things in work.
Okay, fine. Let's talk about gruesome. And it comes to when you go to medical school, you will come across, and you may come across cadavers or sort of like bits of the body, and part of it is that for you suddenly realize that you are interested in what is below the skin, and what is underneath the skin. How do your fingers move? How come when you bend your fingers, there isn't a muscle just here pulling that bit? How come you can hang your whole body weight on the tip of that thing? And once what happens underneath it, you get to see what happens underneath it. You get to rebuild what happens underneath it. So have I seen mushed, crushed, smashed hands, bodies, limbs? Yeah. My job is to rebuild it. I'm so fascinated by how I can make things better that the whole automatic, ew-ness of it is just, I'm going to say, not there. It just isn't. And part of it is that there's that sort of, there is an expectation that it is, and actually we as human beings are actually as mildly hardwired to keep away from that sort of stuff, because actually, dead and decomposing bodies, limb traumas, we then tend to go away from that because we want to avoid it for ourselves. It's a kind of natural protective mechanism. But we as potential doctors are fascinated in what we can do to make things better. And as soon as you look at that and focus down on that, you just don't see anything else at all. You just don't. I just don't.
Yeah. One thing I would definitely add to that as a medical student is on the first day of medical school, you will see things and you'll be like, we walked in and there were 36 cadavers, dead bodies all across the room that we do anatomy on. And through the year, there are certain things that will just make you feel really weird. And everyone has different things. Crunching through the rib cage and opening it up, I thought like I was fine with that. But then going into arteries and seeing the blood dried just went straight through me, and I don't know why. And then I find surgery okay, but then my friend, so common for medical students to nearly faint in surgery. I honestly, I remember. And then slowly you build up a tolerance. And also, as you learn more about the body, you're not focusing on kind of like the pain or the blood. You're, as Mr. Rao said, you're looking, okay, so what's gone wrong here? How do I fix it? You're problem solving, you're working in a team, you're really in the zone. But it isn't like on day one, they throw you into the most gruesome surgery. It all trickles in slowly. And over time, you kind of build up that awareness of what's going on and what things look like. And I definitely think that that's something that you build up a resilience to, and it isn't like shock in your face. It is something that builds over time. Just about dealing with stress, Mr. Rao kind of touched on the fact that you rely on your higher training. Is there anything else that you'd maybe say about dealing with particularly difficult cases or stress other than your high training, maybe the team around you or anything surrounding that sort of thing that helps?
Yeah, I'm going to tell you, it's really important. You see, a lot of people talk about debriefing, and it's important to do that. But actually, it's important to recognize human emotions. I'm going to tell you some of the worst things that I've had to deal with is when I was doing neurosurgery, as part of my training, and that was, you were seeing young people who weren't surviving because they had major head injuries. I drive a Volvo now. What can I say? That's another story. But it was heartbreaking. There's some heartbreaking times and moments which you have where you see people who you can't save, especially when you do pediatric oncology stuff. When you see little kids die, it's not easy to hold on to your own emotions, and actually is to be accepting of it. Is to understand that, is to have a good network of friends, have a broad network of friends. It is really important. It's really, and so what can I say associated with that is stress is difficult. It is something which is there. But the flip side also, which I fundamentally see, is that pressure, this stress you talk about, it's a privilege. It's a huge privilege, and very few people get to experience that. Many people live incredibly boring lives. My kids would talk about it, that you kind of act like a NPC, a non-player character in a game, in a computer game, and you're there and you're kind of just going through the motions, so you get your money so you can then go away and do what you want to at the weekend. You kind of trudge through life, selling whatever you do at the corner shop, working for a new startup company so that you can then, schmeasel up to some of these Instagrammers who are influencers, so that they will then take on your product. It rips through your soul, but you don't care because they pay you okay. I'm going to tell you, medicine just ain't that. It just ain't that. Okay. And that stress you talk about, it's a huge privilege. It's a huge privilege to be able to do it. And yet again, it's this mental construct associated with it, is that actually, once you realize that we have a very privileged life by having that, you kind of then equate and understand what that stress means. It is part of the territory, but also it's just, it's something you deal with, and something you share with your friends. What was the next one?
Something just to add on there, if you Google GMC well-being, there's really interesting documents by the General Medicine Council that if you are reflecting on kind of this thing about dealing with stress, it would be a really interesting document to read, and then kind of build on your knowledge about why is well-being important, what do they do to help doctors in these situations, because these are all really, really good, really important questions. And while it is a massive privilege, it definitely can be difficult, and it is really important. Like, you have photography. What do I love? I like swimming. I love going swimming with my friends, on my own, and that really helps me de-stress. And everyone has different things that they enjoy, but I definitely recommend, as kind of like extra reading, going away and reading the GMC wellbeing document, because it has a lot more information about that. So next question, Hannah says, is there an alternative route to specialize in orthopedics apart from the one you mentioned? I heard there is a more direct route without going through core training.
So in terms of going into orthopedics directly, I mean, so different countries have different structures associated with it. So, but in this country, the classic way is via the NHS, and to do it via, so to do the core training. There is run-through training. In other words, there are certain places where you can look for it, but they often, I'm going to say, are very highly competitive for those run-through things. So as soon as you get through your F1s and F2s, to go straight into the run-through training programs. But those run-through training programs are often subscribed to by people who've already done the other stuff. In other words, they've got lots of experience and they're coming in there at a slightly higher level. My thoughts are is that actually there are people who are, bright and who are really, great, who basically take a year off to do whatever else stuff they do. They then come in and they just got one of these run-through training programs, which is a 6-year program, and I've seen people kind of do it that way. But they, it's possible is the answer.
One more question here. Also, guys, keep the questions coming in the chat if any of you want to ask anything else. If you could give your younger self a piece of advice before the journey you've had, so I'm guessing these guys are probably kind of late teens, early 20s. If you could speak to yourself then, what would be your advice?
Yeah, I think that's a really important question, and I'm going to say, was it an easy route for me? And I'm going to say the answer is no. And I think, to be completely honest with you, the advice I would give is down. There will, am I allowed to say that? I am, because I'm going to say people will try and stop you. Because if it's something you want to do, then you should do it. And I was quite surprised because I didn't quite know why people wanted to stop me. And in fairness, I'd always said I was going to go off and do orthopedic surgery, and then maybe I would then go to do GP and have an interest in injecting joints and all the rest of it. And before I knew it, I was an orthopedic consultant, and going off and being a GP was like, oh, too late now. This is where I am. So the advice is, don't let them stop you. People will. I genuinely don't know why they will, but they will. Probably because you're brighter than them. What can I say? So that's one piece of advice, really, if that answers it. Should we move on?
Yeah. Something else I would add to that is, often one thing that I would definitely say is that run through programs, amazing, like you get straight in there, but often I think you get a lot of experience. Like you just touched on neurosurgery there, and I think that different experiences can define you. So when I was 18, I've always wanted to be a doctor, like one of those really cringe people who's always wanted it their whole lives, and I missed the grades on results day. I got a B in chemistry, and I was genuinely heartbroken, and I just thought my life was over and that was it, and all my dreams were in tatters. And I went and I did a pharmacology degree, and now I'm in my 3rd year of medicine. And I look back, and all the things that happened is quite a cringe thing to say, but actually it's the things that aren't easy that kind of define who you are. And if you're kind of like really struggling with exams right now, or you don't think you're clever enough for medicine, or you're not sure if you're going to be able to deal with the stress, you're honestly a lot stronger than you think. And the setbacks are what makes you the best possible doctor. I think often, for example,
Right.
I can't speak as a surgeon, but I can imagine that if you've gone through urology, HPB, as you do on core surgical training, your experiences, HPB isn't bones, but the things you will learn and the skills you will develop, and the skills, I think you often get different personalities who are surgeons, and you'll gain different things from all those different people. So actually, in reality, what could be seen as the long way round, like for me, I'll have been in uni for 8 years, but in reality, it gives me so many benefits now working that I will use throughout my career, even just above and beyond resilience. So I would definitely have said to my younger self, keep going. You do not need to be the cleverest person in your class. You do not need to be really squeamish. It doesn't matter. You can deal with all those things, but you just have to kind of keep going so long as you really want it. And you can see Mr. Rao talk about orthopedic surgery. He loves it. And if you love the idea of studying medicine, you will get there no matter what. And don't let sorry, I'm going into pep talk mode here, but you really have to just keep going. And if you love it, you'll get there. So what influences where doctors choose to do specialty training? Is it similar to how we decide on our medical school options now, or are there other factors involved?
So, what influences where doctors choose to do their specialty training? So I'm going to tell you, certain medical schools have got certain facets as to which will guide you to certain ways in any case. So places like Oxford, Cambridge and Imperial will generate researchers, okay? Very few of them actually touch a patient, you know, man, that's not entirely true. But actually it's got a tilt towards that side. Other ones are much more orientated towards, you know, general practice, and a lot of the medical schools are orientated towards that. So part of different medical schools will kind of tip you in slightly different ways. I think part of it is that for me, I went to St Andrews, I got taught just a shed load of anatomy, you know, it just really facilitated me then going into surgery. I didn't know I was going to do surgery at the time. I did research, just randomly I did research, and it was on what causes fingers to develop as fingers as opposed to into webs, you know, for swimming, or, you know, so on and so forth. And I had no idea that that in retrospect was going to give me ability to put on things like transforming growth factors onto bits of growing bone to allow those bones to knit together. And that was directly linked to a bit of research I'd done 10 years ago. It's, you know, one of the things is that you kind of join the dots up backwards. You kind of go, gosh, this is where I'm going. And you kind of look back to see the world of experience that you had. And so, you know, gain lots of experiences, and you'll find that that will get you to the training you want. Where do you choose, and how do you choose your specialty training in terms of once you're in there? Well, my thoughts are is that if you're really committed to doing, for example, orthopedic training, there is there will be a training program somewhere near you, you know, so it depends upon whether you want to do the training close to home, whether you go, look, I really love the hills and hill running. I know a friend of mine who was in Cambridge, and she gave up her place in Cambridge, transferred to Sheffield because she just loved running, and she loved running in hills. Cambridge, flat as a pancake, there ain't no hills there. You know, it seems odd to move medical school for that, but it's also what you want for you. And finally, in terms of training, go wherever they're going to train you, you know, is how I see it.
Okay, we've got a really good question here. What are the advantages and disadvantages of NHS versus private?
Okay, fine. So private, you're basically working in private. You work by yourself. You can only, in essence, get through to do private practice once you've kind of got qualifications to say that you can work independently as a consultant. So you have to kind of go through the whole training and get out with a consultant stamp as such. Once you do that, then it gives you the facilities to do, you know, both. One or the other. A lot of my consultant colleagues love their families, want to spend their time just with them and watching their children grow up and going to the park and not wanting to do private practice. The appeal of private practice is getting less and less. And I'm going to tell you, of the last 4 consultant orthopedic surgeons we've appointed, not one of them does private practice. So there are people who go, look, I'm just interested in the money, it's very lucrative, you know, so they set themselves up as, you know, specialist, you know, knee surgeons or hip surgeons, and they just do that privately. But then you don't get the mix in terms of camaraderie. You don't do trauma. You know, trauma is just not done privately. So I find it really fascinating to just put people back together again. So, you know, it doesn't appeal to me just to do private practice, because private practice is just the elective stuff predominantly, the, you know, the hip replacements, the knee replacements, the you know, the ligament reconstructions. It's elective procedures, it's the degenerative procedures, and there's no trauma associated with that. In terms of the pay is significantly better doing it privately, but as with all things, you are taxed absolutely exponentially on it. And so if you end up doing private practice and you earn over a certain amount, you actually more or less lose money after you've paid indemnity fees and so on and so forth. So it's not just about money for it. But yeah, so there's choices to be made. I do a little of it, and the reason I do it, I'm just going to say, is that there are certain people who just don't want to wait or can't wait because the NHS waiting times have gone up, especially in the times of COVID. And so, you know, for example, if you're in Wales, your waiting time for a hip replacement is 3 years. Yeah, 3 years. If you're in Northern Ireland, it's 5 years, going up to 7 years. It's like, and so people go, look, I can either choose between going on holiday or having a hip replacement. I can't go on holiday anywhere. I'm going to have a hip replacement, you know, because I just want to walk. And so they come along and have it done private. People spend money on what they want to spend money on. You know, if you've ever gone and spent money on an ice cream, you bought it because you wanted an ice cream. You know, people buy it because they want their hip replacement. I'm not judging them on whether they like strawberry ice cream or not. Do you see what I'm saying here?
Yeah.
So there's choices for people.
If you're dealing with all the broken bones, but then they've got a lacerated spleen or a head injury, how do you kind of decide whether to operate or what to do?
Oh yeah, no. I'm going to tell you, that's where, yet again, I'm going to go back to training. You know, you do the stuff which is going to kill them first. So if they're bleeding out from their spleen, that has to be fixed first. But also what's happening, and most likely it's actually a road traffic collision. It's normally that they've got their pelvis bust open, you know, so you're going to have to put an external fixator on it. Now, if you're in A&E, you know, I'm going to tell you, they call me down. I put an external fixator in A&E whilst we wheel them up to theatre, you know, but have to put the external fixators still in to allow the general surgeons access to their belly so that they fix their spleen. As soon as their spleen is fixed, we then have to go in there and then rod their femurs. So, you know, we save their lives. We save lives, you know. It's a good thing, isn't it? Yeah.
Something I will always remember is in anatomy, when I first started, my anatomy tutor gave every single person in the group a polo, and he went, I'll give £150 to anyone who can break a polo in one place. And we were all like, oh, easy money. And he said a pelvis is a polo, and if anyone can break it in one place, I will give them £150. We were all there for ages. Pelvises always break in two parts because they're circles. So that's kind of why I'll just always remember that, you know, little things from anatomy and stuff. So guys, that's actually all our questions. Before we kind of wrap up, does anyone have anything else they want to ask about the Royal College of Surgeons, about orthopedics, about private work, anything at all? I'll just that's brilliant. We've answered everybody's questions. If you guys could please fill out the feedback form. I've just put a link to it in the chat. It would be so helpful. We post on our Instagram the links to all the Zoom things every week, and we have loads of information about personal statements and things like that. So if anybody wants more information about that, then drop us a DM on Instagram, give me an email. Yeah, just get in touch, and we're here to help you guys. And when you're all medical students, you'll be experiencing all this stuff too. We hope you found it helpful. Yeah, thank you for coming.
It's been great. I hope you really enjoyed it, and good luck, all of you. I hope to see you soon.
Oh, bye. Cleopatra has just asked, how are the work hours while we're here?
Oh yeah. The work hours are, I'm going to tell you now, even as a consultant, they're actually relatively, they can be good in that actually you're on, almost everyone's on a fixed 10 contract. So it's 4 hours per session. So most people are on 40 or 44 hours a week. Often with the on-call, that goes above that. So the work hours are getting better. So it is okay, and it's doable.
Perfect. Well, guys, oh, and Aryan just said, what would you recommend for extra reading?
Yeah, I'm going to tell you, for me, things like there's lots of stuff out there. What I quite enjoyed were things like a lot of the Atul Gawande books.
I read those. They're so good.
They're so good. And so one of them, especially if you're interested in surgery, is the one called the Checklist Manifesto. That talks about the WHO surgical checklist and how it got set up and how it saves more lives than, let's say, antibiotics realistically, because actually if you do the right operation on the right person at the right time, you get the right results. And how do you do that? How do you make sure that everyone does that always? And so I think those are the key facilities for it. So if I'm going to say read one book and talk about it, I would suggest the checklist manifesto, especially if you're going to say, look, I want to do orthopedics or surgery.
Yeah, perfect. Well, guys, thank you so much, everyone, for coming. We hope you found it useful.